For a while there, it seemed like Ontario Premier Doug Ford, he was becoming another lockdown-loving politician. We got a lot of public health officials across Canada asking for more and more onerous restrictions to be placed on businesses, activities, on people's livelihood. Toronto Public Health, they're putting forward more proposals to the province, seeing Torontonians' actions further restricted, including saying you can't leave your house unless it's an essential activity, from a list that they have deemed are the things that you are permitted to leave for. They also want to see a whole bunch of new added restrictions to business. Now look, we're all reasonable folks here, and if a case is presented that, well, this particular setting that we know is driving cases, here's the numbers, here's the data, here's deaths that have been caused by this setting being open, people congregating in it. All right, well, let's talk it out, and well, maybe we can actually work something out here, shut down those sectors, support those people in the interim, and so forth. But that's not what we're being presented with here. I've discussed before about how various reporting has proven that they don't know for certain what is driving a lot of these cases. Oh, gyms, restaurants, gotta shut them down. Okay, show us the work. And they don't have that. Some public health officials, they've actually stepped forward and kind of admitted that the spreadsheets, the software they're working with isn't even allowing them to capture that level of information. That's really troubling out there. That's really problematic. So when some public health officials are calling for more restrictions, it's because, well, they sort of kind of think maybe this is going to help, or they have a hunch, or yeah, they feel this is probably causing stuff. That's not enough. And Doug Ford, he seemed like he was going along with this inertia for a while. He seemed like he was a lockdown-loving politician, but on Monday, good on him, he actually put his foot down and said, no, he wants to see the evidence from places like Toronto Public Health before he acts on these restrictions. In fact, he went so far as to say he wants to exhaust every single avenue first prior to ruining a person's life. It was really great to hear him talk that way because he was acknowledging lockdown should be the last recourse. There's a very high burden of proof to do further restrictions, and that further restrictions are harming people as well, just as much or, well, to whatever degree as the coronavirus is. If we had some super calculation where we could determine the costs of the lockdowns versus the negative health effects of coronavirus, well, who knows what it would say, but it's certainly looking like the lockdowns are really, really having their toll on people's health, on the economy, and more. We got to take a holistic look at this, and more medical experts are actually stepping forward to argue that very point, and it's great to see that Doug Ford is heading in that direction.